So where the study originated from was 2 endocrinology offices within our network, where we had this team-based approach with an endocrinologist, a pharmacist, a behavioral health specialist, as well as a dietitian. And it was a 12-week program where patients had an initial appointment and they met with each member of the team. And then following that appointment, they had 12 weeks of follow-up based on their needs. So majority of patients followed up with the pharmacist to optimize medication or with a dietitian because a lot of dietary improvement was needed. And then they'd return in 12 weeks for a follow-up appointment to get repeat A1Cs and other lab values, as well as to meet with everyone on the team. And we did find quite significant results. Our primary objective was looking at reduction in A1C. So most patients showed a median reduction of 1.3. But we also broke it down further into those that started with a higher A1C. So if they had an A1C of greater than 9, which majority of patients did, we actually found a reduction of 3.1 for A1C. And then we looked at other variables as well. So we looked at those on statin therapy at baseline to 3-month follow-up, and it was found to be statistically significant that we increased the number of those on appropriate statin therapy, as well as aspirin therapy in combination also with the diabetic distress scale score. So it's multifactorial that there's improvements in all these categories. So overall, the goal is then to try to roll this out further into other primary care sites based on the success we've had. I think probably the biggest challenge is just initiating these teams. So right now, most of the primary care sites only have a physician or a nurse practitioner or PA. So the goal really is to start transforming these sites to have a pharmacist, to have a dietitian, to have a behavioral health specialist. And once that team's intact, then it becomes more of a challenge of building it into workflow. So for the current clinics, it was only 1 day a week that the program was implemented. So we would see 4 to 5 patients that were new to the program each week because schedules are already full for most providers. So it was just really trying to figure out the best day or time for that program to be started.